Hello and welcome to Workers Comp Unwrapped, the podcast that simplifies workers' compensation for physicians. I'm your host, Max, here to give you clear, actionable insights to navigate the medical legal side of workers' comp. So let's get started. Welcome back to Season 2, Episode 16 of Workers Comp Unwrapped. With me today is, we have Aisha, who has 15 years of experience in the workers' comp industry.
It's great to be here.
Today, we're talking about how data analytics can help providers identify patterns in denials and underpayments.
Oh, and treatment trends to optimize revenue.
Right. You might be thinking, data analytics, is that really going to make a difference in my bottom line?
Right.
But get this. Some experts estimate that 30 to 40% of workers' comp claims encounter delays or denials.
Because of billing errors.
Exactly. That's potentially millions of dollars in lost revenue.
Oh, absolutely.
So what's the secret weapon? What do providers need to fight back against these losses?
You know, it's not as complicated as you might think. The key is using data analytics.
Okay.
Think of it as a way to take all the billing information you already have and turn it into actionable insights.
Okay.
By analyzing patterns in your data, you can start to predict and prevent denials, catch hidden underpayments, and even spot trends in treatment authorization.
Okay, so it's not just about number crunching.
No, not at all.
It's about finding those aha moments in the data that can actually change how you do business.
Absolutely, yeah.
Can you give me an example? How might this play out in a real-world scenario?
Absolutely. Let's say you're an orthopedic surgeon specializing in workers' comp cases. You've noticed a recent uptick in denials.
For a specific type of hand surgery?
Yes, exactly. Instead of just shrugging it off as a random occurrence, you can use data analytics to dig deeper. You might discover that a particular insurer is consistently denying these claims.
Because of a missing pre-authorization form.
Exactly. By identifying this pattern, you can put a system in place
to ensure that pre-authorizations are always obtained before surgery.
Right.
Significantly reducing your denial rate for that procedure.
Yes, precisely.
So it's like having a detective on your team.
Exactly.
Constantly looking for clues in the data.
Yeah.
To help you solve those billing mysteries.
That's a great way to put it.
But workers' comp billing is notoriously complex.
Oh, it is.
It's not just like regular health insurance billing, is it?
No, you're absolutely right. Workers' comp has its own unique set of challenges. One of the biggest headaches is dealing with those state-specific fee schedules.
Right.
Unlike regular health insurance, where you might have national reimbursement rates, workers' comp fees can vary wildly from state to state.
Right.
And to add another layer of complexity, each insurer might have its own unique set of authorization requirements.
Oh, so it's like trying to navigate a maze with constantly shifting walls.
It can feel that way sometimes.
It's no wonder so many providers struggle with denials and underpayments.
Yeah.
It seems like one tiny mistake could cost you thousands of dollars.
Absolutely, it's high stakes.
And that's where data analytics can be a game changer.
Exactly. It helps you see the bigger picture.
Right.
Identify those hidden pitfalls and create a more efficient and profitable billing system.
Okay, let's dive into some specific challenges
Sure.
that data analytics can help providers overcome. I know denials are a major pain point for many practices.
Oh, definitely.
So where do we even begin to tackle this issue with data?
When it comes to denials, data analytics can be your secret weapon.
Okay.
The first step is to identify the most common reasons for denials in your practice.
Okay.
Are they due to missing documentation, incorrect coding,
Failure to meet authorization requirements?
Yes, exactly. By analyzing your denial data, you can pinpoint those recurring issues and develop targeted strategies to address them.
So it's about moving from a reactive approach, where you're constantly putting out fires, to a proactive approach,
Yes.
where you're preventing those fires from starting in the first place.
Exactly. Let's say your data reveals that 25% of your denials are related to missing pre-authorization forms. You can then implement a system that automatically flags claims requiring pre-authorization, ensuring that this crucial step is never overlooked.
That's a fantastic example of how data can be used to streamline workflows and prevent those costly errors. But what about underpayments? Those seem much harder to catch, don't they?
They can be, yeah.
How can data analytics help us identify those hidden revenue leaks?
Underpayments are sneaky, but data analytics can help you shine a light on these discrepancies.
Okay.
Think of it this way. You have a contract with each insurer.
Right.
That outlines the agreed-upon fees for various services. Data analytics allows you to compare the actual payments you're receiving to those contracted rates,
Okay.
flagging any instances where you're being shortchanged.
So it's like having a financial watchdog constantly monitoring your revenue stream,
Exactly.
making sure you're getting every dollar you deserve.
Precisely. And it's not just about individual claims. By analyzing payment trends across different insurers,
Yeah.
you can identify those who consistently underpay or those who use outdated fee schedules. This data gives you the leverage you need to negotiate better contracts and ensure fair reimbursement for your services.
This is incredible. I never realized data could be so powerful in uncovering those hidden revenue opportunities. But it's not just about increasing revenue, is it?
No.
Data analytics can also help us improve efficiency and streamline our billing processes, can't it?
Absolutely. Think about those tedious tasks that bog down your billing staff, like manually checking fee schedules or verifying patient information. Data analytics can help automate many of these processes, freeing up your team to focus on more complex tasks.
Like claim appeals or patient communication.
Exactly.
It's like giving your billing team a superpower.
I love that analogy.
They can finally escape the drudgery of paperwork and focus on the things that really matter. But for those providers who are new to data analytics, where do they even begin? It seems like such a daunting task to implement a whole new system.
You know, you don't have to overhaul your entire operation overnight. Start by identifying one or two key areas where data analytics can make the biggest impact. Maybe you're struggling with a high denial rate for a particular procedure, or you suspect that a specific insurer is consistently underpaying you.
So start small, focus on your biggest pain points, and build from there.
Exactly. And once you start seeing those positive results,
Fewer denials, increased revenue, a more efficient workflow.
right, you'll be amazed at how quickly data analytics can transform your entire practice.
This has been an eye-opening conversation. I'm already starting to see how data analytics can be a game changer for workers' comp providers. We'll be right back with part 2 of this episode, where we'll explore some real-world examples of how providers are using data analytics to optimize their billing processes and maximize their revenue. Stay tuned. We're back, and I'm still buzzing about how powerful data analytics can be for workers' comp billing. We've talked about the potential, but can you give us some concrete examples of how providers are actually using data to make a difference in their practices?
Absolutely. One example that comes to mind is a physical therapy clinic. They were struggling with denials.
For a specific type of back treatment?
Yeah, for a specific type of back treatment.
Okay.
And they were using data analytics to track their denials. And they noticed a pattern.
A particular insurer was consistently denying claims for this treatment.
Yes, citing lack of medical necessity.
So they were doing the right treatment, but hitting a roadblock with this one insurer.
Right, and they dug deeper into their data
Yeah.
and discovered that the insurer was using outdated treatment guidelines that didn't reflect the latest evidence-based practices.
Oh.
Armed with this data, they were able to appeal the denials and provide the insurer with the latest research supporting the treatment.
So they fought back with data. I bet it paid off.
It absolutely did. Not only were they able to overturn the denials and get paid for the services they provided, but they also helped educate the insurer about the latest treatment guidelines, potentially benefiting countless other patients in the future.
That's a fantastic example of how data can be used to advocate for both providers and patients.
Yeah.
It's not just about dollars and cents. It's about ensuring that injured workers get the best possible care. What other success stories have you come across?
Another one that stands out is an orthopedic practice that was losing revenue due to underpayments for a common surgical procedure.
Okay.
They implemented a data analytics system that automatically compared their billed charges to the contracted rates for each insurer.
So they had a system in place to make sure they were getting paid what they were owed. Smart move.
Exactly. And what they found was shocking.
Oh.
One insurer had been consistently underpaying them by an average of 15% for this particular procedure.
Wow. That's a significant chunk of change.
They did.
Did they just accept it?
No way. They had the data to back up their claim, so they went back to the insurer and renegotiated their contract, securing a much fairer reimbursement rate.
That's a huge win. It just goes to show you that knowledge is power, especially when it comes to negotiating with insurers.
Absolutely. Data analytics gives you that power by providing you with the evidence you need to make informed decisions and fight for what you deserve.
These success stories are inspiring, but I imagine some providers might be feeling overwhelmed at the thought of implementing data analytics in their own practices. What advice would you give to someone who's just getting started?
My first piece of advice is don't be intimidated. You don't have to become a data scientist overnight. There are plenty of user-friendly billing software programs out there that have built-in analytics dashboards that are easy to use and understand.
So you don't need to hire a team of analysts or learn complex coding languages to get started.
Not at all. Start with the basics. What are your biggest pain points? Are you struggling with denials for certain procedures? Are you concerned about underpayments from specific insurers? Focus on those areas first and look for a billing software that can help you track and analyze those specific data points.
That's great advice. Focus on what matters most to your practice and gradually build from there. But what about the human element? Data is great, but you still need a skilled team to interpret it and take action, right?
You're absolutely right. Technology is just a tool. It's the people who make the real difference. That's why it's crucial to invest in training.
Your staff.
Yes, your staff, on how to use and interpret the data.
So it's about empowering your team to become data-savvy decision makers.
Exactly. When your billing team understands the data, they can identify patterns, spot anomalies, and take proactive steps to improve your billing process. They become your frontline defense against denials and underpayments.
This has been incredibly helpful. I'm feeling much more confident about the power of data analytics in workers' comp billing. But before we wrap up, I'm curious about what the future holds for this field. What exciting trends are on the horizon? We've talked about the present, but now I'm curious about the future. What's next for data analytics and workers' comp? What trends have you excited about the possibilities?
It's an exciting time to be in this field. One trend that's really gaining traction is the use of predictive analytics.
Predictive analytics. Sounds kind of like something out of a sci-fi movie. What is that exactly?
Think of it as using data to predict the future.
Okay.
In workers' comp, this could mean identifying patients who are at high risk of developing chronic pain, or those who might require more extensive treatment. By analyzing historical data, you can start to see patterns that help you anticipate potential challenges and intervene early.
So instead of just reacting to problems after they arise, we can use data to get ahead of the curve and potentially prevent those problems from happening in the first place.
That's amazing. Can you give me a real-world example? How might this work?
Sure. Let's say a construction worker injures their back on the job.
Okay.
By analyzing data from similar cases, predictive analytics might reveal that workers with certain pre-existing conditions or who are of a certain age are more likely to develop chronic pain following this type of injury.
So armed with this knowledge, what can providers do differently? They can create a more targeted treatment plan.
From the outset.
Yeah, from the outset. Perhaps incorporating additional therapies or interventions that have been shown to be effective in preventing chronic pain. This could mean the difference between a patient returning to work quickly and fully recovered versus facing a long and debilitating battle with chronic pain.
This is truly revolutionary. We're not just talking about saving money here. We're talking about improving people's lives. What other innovations are on the horizon?
Another exciting area is the use of artificial intelligence, or AI, in workers' comp billing. AI algorithms can automate many of the tedious tasks that currently consume so much of a billing team's time, such as coding, claims scrubbing, and payment posting.
So AI is taking over, the robots are coming for our jobs.
Not exactly. It's more about freeing up human workers from those repetitive tasks, so they can focus on more complex and strategic work. Imagine your billing team having more time to analyze denials, negotiate with insurers, and educate providers on best billing practices.
That's a much better use of their skills and expertise. It sounds like AI could really streamline the entire billing process and make everyone's lives easier.
Exactly, and it doesn't stop there. We're also seeing a growing emphasis on data visualization and reporting. New tools and dashboards are making it easier than ever to understand complex billing data and communicate those insights to stakeholders.
So it's not just about crunching numbers, it's about making that data meaningful and actionable.
Precisely. Clear and concise data visualizations can help you identify trends, spot anomalies, and communicate your findings to physicians, administrators, and even payers. This can lead to better decision-making, more effective contract negotiations, and ultimately, a more efficient and profitable workers' comp system.
This has been an incredible journey into the world of data analytics and workers' comp billing. Thank you for sharing your expertise and insights with us today. For our listeners, I hope this episode has inspired you to explore the possibilities of data analytics in your own practices. Remember, data is power. By harnessing the power of data, you can optimize your billing processes, maximize your revenue, and ultimately provide better care for the injured workers you serve. Thank you for listening to Workers Comp Unwrapped. If you found value in today's episode, share it with your fellow medical providers and healthcare specialists. For more information, contact us at lena.klein@medicallienmgt.com or visit our website, medicallienmgt.com.